So I found, actually, I think it was a Thorn research document that had in there a lot of different things. And he was a picky eater at the time. And so what I did is I made him a banana peanut butter smoothie every morning for breakfast. And I put in there omega. I put in there high dose vitamin B6, magnesium, probiotics, a multivitamin to be able to catch some of the things that may have been going on. Like I said, 6 months later, he's not on the autism spectrum anymore. I was so confused at that time that I contacted the psychologist who did the original evaluation and I said, "What am I supposed to make of this?" And she said, "You know what?" She said, "It doesn't matter. He was not a borderline case." She said, "Just keep doing what you're doing." So that's what we did. And he's very intelligent, very business minded.
Your health is shaped by more than symptoms. Through real stories and expert insights, we explore how your genetics, environment, and daily choices affect your well-being. We uncover root causes and share practical tools to help you find the healing you need. Welcome to the Forum Health Integrative Medicine Podcast.
Welcome back, everyone, to our weekly podcast. I'm really excited to be here today with Amber Shuey. She has, I think, one of the greatest stories. I think people get into integrative medicine for a variety of different reasons. And honestly, you're going to tell me, I guess, I don't want to say too much and be wrong, but how much this influenced how you practiced medicine and that sort of thing. But I'm really excited to have you. And I just want you to jump in and tell me, I guess, start with how you decided to practice medicine, and then we'll segue into these personal experiences. Maybe they're the one and the same.
Okay. So I work with I work as a health coach with Dr. Saxena. And how I got what led me in that journey was my sons, actually both of my sons. I have a 36 had a 36-year-old son. He passed away last August. Yeah, I'm sorry. It's going to take me a minute to gather my thoughts here, but
Absolutely. Yeah.
yeah, he had there was inconsistencies with his brain that nobody really understood. So when to make a long story short, the reason that I even found out that there was such a thing as health coaching and functional medicine was because of him. I was looking for help. At that time, he was living in a group home. He was having grand mal seizures every couple weeks. And he was reminding me, honestly, of my dad who passed away of Parkinson's. His he was just his brain function was so slow, his movement was very slow, and he was only 30-ish at the time. And so I was really afraid. And so
Right.
that's what got me looking for some help. I knew of the functional medicine concept because my younger son, when he was 8, he was diagnosed on the autism spectrum,
Okay.
very high functioning on the gifted end of things. And it was just, he was having a hard time with stress, and the answer through allopathic medicine was an antipsychotic. And I was like, nope, not going to do that to an 8-year-old.
Were you, no, not Amber, let me back up.
Mhm.
This is you have two sons. One has
Yes.
passed away. Your younger son is still living. He's the one that you said earlier was 23,
Yeah.
right? And your older son passed away a year ago.
Yeah. It'll be a year in August.
So when your younger son was 8 or 9, somewhere in there, is when you sort of were made aware of other options for healthcare besides just your regular allopathic family doctor.
Correct.
The diagnosis of high functioning autism, that happened around what time? When your son was 3 or 4?
No, that was when he was 8.
When he was 8. Okay. So until he was, I don't know, 4, 5, 6, he did you notice that there were things that you thought there's some differences?
I did. In fact, I think he was around 2 when I sought out a naturopathic doctor who at that time he recommended, that we make some changes like gluten free at the time. And I did see a big difference, especially behaviorally when he was young like that.
Okay.
It
Now,
should.
meanwhile, your older son at this time would have been a young teenager. There's 10 years or 12 years in between them?
Yes.
Okay. So, and your older son, his health was normal, when he was a young teenager?
He was a 10-pound baby. I thought he was perfectly healthy when he was like preschool and I was trying to teach him the alphabet. I realized that it wasn't easy to teach him. He repeated kindergarten, but it was never consistent. Like he didn't seem to be like he was intellectually disabled or anything. He seemed like he was totally capable, but it was just something was wrong and I couldn't. In fact, a psychologist told me at that time he was 5 and I was told he was a diagnostic nightmare.
I guess that's code for I'm not sure what's going on.
Yeah.
Um, yeah. So your older son as a young child, it was hard for the medical professionals to know what was happening. He was diagnostically challenging. But he was growing up, and then your younger son was the one that was diagnosed on the autism spectrum, uh, high functioning. And so that's where you were introduced to the idea of something outside of just going to your regular family doctor or pediatrician. You said that it had been recommended that your younger son take an antipsychotic.
Yes. And so, I went a little crazy and up all night, researching to see how I could help him.
Right.
And I found the right information. I'm still so grateful to this day that I found the right information. And now, working along with functional medicine doctors, I realized how wise the information I found was. It worked. I applied these strategies within 6 months. It was funny. I entered him into a study at the Children's Hospital of Philadelphia because
Uh-huh.
I saw how much these things were working and I wanted to help other people. And I didn't know that they were going to reevaluate him for the spectrum.
Mhm.
And they said he no longer fit the criteria.
Oh, so he didn't qualify for the study anymore.
Right. Exactly. They didn't care
He's
why.
he's not autistic, so yeah, we're
Right.
not interested in the solution. We were just gonna do a study.
Yeah.
Wow. Wow.
I
So
was
tell
so,
us tell us the
I
things
was,
that you did for him that made it so that he no longer met the diagnostic criteria.
what were some of the things?
Yeah, yeah.
Yeah. So I found actually I think it was a Thorn research document that had in there a lot of different things and he was a picky eater at the time and so what I did is I made him a banana peanut butter smoothie every morning for
Okay.
breakfast and I put in there omega, I put in there high dose vitamin B6, magnesium, probiotics, uh, a multivitamin to be able to catch some of the things that
Mhm.
may have been going on and he just, like I said, 6 months later, they're like, "Sorry, he's not on the autism spectrum anymore." I was so, like, confused at that time that I
Right.
contacted the psychologist who did the original evaluation, and I said, "What am I supposed to make of this?" And she said, "You know what?" She said, "It doesn't matter. He was not a borderline case." She said, "Just keep doing what you're doing." So that's what we did, and he's very intelligent, very business minded.
Yes, you know, it's been 15 years because you said he's 23, so 15 years later,
Yes.
I assume he still takes those supplements?
You know
Takes
what?
his own B
He's
vitamins?
learned through diet what things are like. Both of my sons had a major issue with gluten, so he's
Okay,
learned what things that he can do. And then, at 23, as you probably already know, Dr. Peterson, it's an adventure. They're still figuring out what they're doing.
sure. But
Mm,
he's careful with what he eats because he knows it makes him feel different.
exactly. He's put
Okay.
that together, and this is where my older son, when I realized that, where when got scared and I seen that traditional medicine with being on at least four different seizure medications wasn't working. He was still having seizures every couple weeks and he was heading downhill and I seen it. So I got desperate. That's when I looked. What I did is I contacted the Institute for Functional Medicine. Saw Dr. Hyman at that time had an article of somebody else that he was able to help with seizures. So I was trying to figure out how, because I knew I couldn't handle that myself. So
Right.
I got put in touch with Dr. Saxena. When I got in touch with her, that's when they mentioned health coaching.
How
And
long ago was that you after, working with Dr. Hyman and his protocol, how long ago did you start seeing Dr. Saxena?
I would say it was probably 5 or 6 years ago now.
For 6 years, okay. Now, I guess I feel like we almost need to tie these 2 cases together. Both of your sons had inflammation in their brain,
Exactly.
and the brain's interesting because it does so many things, and as physicians, maybe this is a little bit of an indictment, and maybe it's too strong, but we're pretty it's pretty hard for us to miss some of the physical presentations like seizures, right? Like, you have a seizure and the doctors all say, "Oh, yeah, that's a real thing." You have brain inflammation that causes cognitive dysfunction or causes, you know, uh, emotion to be different. That's harder to identify, and so perhaps there's a reason why autism wasn't something that we noted as early as seizures, right? That seems obvious, but inflammation in the brain can affect all sorts of things, and both of your sons had inflammatory situations in their brain, and similar triggers caused different symptoms, it sounds like. Is that accurate?
Very accurate. Yes.
Yeah. And similar therapies had benefit to both of them, but in one case, your younger son was able to cognitively function in a more typical way. Is maybe that's the best way to describe his resolution of the high functioning autism
Yeah.
is
And,
functioning more neurotypically?
yeah, and you don't know what you don't know. So whenever I was younger and my older son was young, I didn't understand what was going on. Fortunately, by the time my youngest son, I was starting to be able to put the pieces together. So I was able to help him from an early age. So my older son, he was an adult before I, even stepped in to try to help at that time. And
Wow.
this is why this is the message that I'd like to get across is that if you as a parent notice something isn't right and get help, I mean, our Dr. Saxena, how she was able to help my older son, even though it was for a time because of his choices later. It was amazing. Like the difference was, I'll never forget the changes on him. It's so sad. I'll let you continue to talk.
Well, no, talk about the things that you guys did together. Talk about because when you went and saw Dr. Saxena for the first time with your older son, what's his name?
Matt.
Matt. So when Matt and Dr. Saxena met, and you were there, I'm sure, right? So the three of you are meeting. Talk to me about how what happened. What did he
Yeah.
what did she suggest? What were his symptoms at the time? I want our listeners at home to think, oh wow, okay, I can sort of see how this happens and what things could give my child or my loved one a change.
Yeah. So we met with her virtually, and I can still remember being on that video with her. And my son was like, he was on a different screen and he was having a hard time even staying awake. He was very, so that was the beginning of it. She found some things that were really instrumental. She said that he had one of the lowest omega-3, omega levels that she had ever seen.
Okay.
So that was one of the things that she recommended was starting him on omega supplements and we did that. Gluten was another thing with him. It was definitely inflammatory. I knew this from the time he was young because, I
Yeah.
seen he had loose stools, very often after gluten exposure. It's different when you hear from a doctor like to stay away from.
Yeah, for sure. For sure.
Mhm.
And for the patient as well. And I think it just
Yeah.
depends on where people are at, but I've told 8-year-old kids that they can't have gluten and they've sometimes responded better than 35-year-old men, right?
Yes.
So it just I think hearing it from someone when they have some testing is helpful too, right? Sometimes there's not a test that shows it and you just have to trust the provider that you're talking to. But so your son started taking omega-3s, he was willing to eliminate gluten.
Yes. He moved home. He moved in with us for about year and a half. And of course, in our house, we really try to just eat whole food. real food. So got him away from all the fake stuff, basically. And
Now, was that true? Like when he was growing up, were you more of a healthy eater? And then when he moved away from home the first time, like his symptoms got worse because
when he
now he
was
was eating.
young, when he was young, I was very, very young, too young,
Okay.
actually.
So
So
you weren't eating this way when you were raising
no,
him. You didn't know.
no, no,
Right. Okay.
right.
And what symptoms did your older son have when like you talked about the seizures, and I'd like to
Uh-huh.
dive into that a little bit. When did seizures start for him? And what other symptoms besides seizures did you note?
At Forum Health, we uncover the why behind your symptoms. With advanced lab testing, hormone optimization, and cutting-edge therapies, we help you heal and perform your best. And now, through shopforumhealth.com, you can access physician-grade supplements trusted by our providers, supporting everything from adrenal health to focus and longevity. Learn more at forumhealth.com and explore supplements at shopforumhealth.com.
Yeah, so it was just like the inconsistency in that brain, his cognitive function. One time he was good, and then another time he just wasn't. Behaviorally, he had symptoms when he was young, but he was always a really caring person. Like he never had, it was just so I felt like there was just something going on and I just didn't understand what it was. So, yeah, that had always really stuck in my mind. What in the world was the connection with that? His very first grand mal seizure, he had just smoked a cigarette.
Okay.
And
Wasn't a little kid. How old was he at this time?
yeah, right. He was 18.
18. So 18, he had his first seizure. And he'd always had some atypical neurologic where sometimes he's good, sometimes he's not, emotionally or cognitively.
Right.
But that's the first time you saw a seizure. And it was right after he had a cigarette. So
Correct.
presumably some high amount of dopamine post nicotine, and he has a seizure. And then he had seizures pretty consistently from then until he was in his 30s.
Yeah,
Just
off
right.
and on. He would have them, the seizure medications. Sometimes I don't know if it's that they didn't work. Sometimes he didn't always remember to take them because he had memory issues as well.
Hmm.
But yeah, that first cigarette at 18, and then when he was 30, he was diagnosed with primary progressive multiple sclerosis. And when he got that diagnosis, it didn't make sense to me because he wasn't typical multiple sclerosis. Like he walked just fine. He didn't have numbness and tingling. He didn't have any of those symptoms that you would typically see with MS. And I got to thinking, and I was like, I wonder if he like had MS all along, like since he was young. So I looked up pediatric multiple sclerosis, and this is where I found these medical articles that were so intriguing to me because basically pediatric onset pretty much starts in the brain. It's more brain involved. So all of those things made sense with that. And there's two triggers for it becoming a more progressive kind of MS.
Okay.
One was a lack of vitamin D, and the other one was cigarette smoke. So
So
yeah.
we don't know retrospectively, though. It seems like this may have been the case all along.
Mhm.
When you were working with Dr. Saxena and he started taking omega-3 fatty acids and he was eating differently during that time, did you see that he had fewer symptoms?
Oh my goodness. There was so many things. Yeah, his cognitive function majorly improved. Like, towards the end there, he got a job. He went into a car dealership and he applied as a detailer at a car dealership. The sales manager saw him and said, "You don't need to detail cars, you need to sell cars." And he had him go through the training, which we've never seen him be able to do that before, to like really focus in on the training. He got to learn all about the different cars and it was amazing. His metabolic health had majorly changed because he went from pre-diabetic. He lost like 40 pounds. He looked so much better. Um, you know what happens at a car dealership. You know what the salesmen usually do. Yeah, they smoke cigarettes and they eat a bunch of gluten containing stuff, and you want to be like everybody else, and I get it.
Right.
And unfortunately, that was the start of the decline, and I saw it coming, Dr. Peterson, but there was nothing I could do, at that time.
Yeah. Yeah. The autoimmune underlying etiology of MS is well accepted, even in conventional medicine. What the triggers are, I think, are less well appreciated, right? And it seems like what you're describing, your experience ha- has been that with Matt, you didn't know initially what was going on, but there was something that would come and go with respect to his cognitive function. And then it slowly progressed and was triggered with this cigarette. And then it improved when you took out these triggers, when you took out the gluten, when you improved his, uh, the possibility of his membranes in his brain to function better because he had omega-3s. And then things were good. And then because of triggers like gluten or nicotine, the autoimmunity, the inflammation in the brain got worse again. In a way, I don't know. To me, the story that people should um, that what you said is probably the very most important. If something doesn't seem right, then keep investigating. But then the other thing is, this is this is not a situation in life where biology just either we got the answer and here's the drug, or we know what's wrong and we cured it and now you're better. Our health is something that's an ongoing process, which shouldn't seem like a surprise. I can't discover that I need to drink water and have it once or twice and then not have it again and think I'll be fine. I have to have it every day, right?
Mhm.
When we discover the things that are creating these inflammatory processes, whether it's arthritis, dermatitis, or neuroinflammation, whatever autoimmune presentation you're having, you're going to have to continue to do these things for the rest of your life, or the autoimmunity will flare back up.
Yeah,
So, as a coach, that's probably what you spend your time doing, is helping people with that very thing, right?
it is. Yes.
Talk to me about that, your journey. At some point, you decided to make this a career for yourself as opposed to you being a person in need of this.
It wasn't at some point. Actually, I was a business owner. As soon as I knew that there was this functional medicine health coach,
Mhm.
I stopped everything else I did and I dove right into it. I went right to the
Oh, wow.
Functional Medicine Coaching Academy. And yes,
So this was immediate. This was like a calling for you. You were like, if I had known this before, I would have done
yes,
this before. The
absolutely.
moment you find this out, you're now an evangelist for true health.
Yes.
Wow. And how long have you been doing this?
I started with Forum Health. It'll be 4 years in December.
So tell me some of the highlights, and then I'm going to ask you about challenges because patients have agency, right? And so there's times when you've probably transformed someone's life, and then times when you've thought, oh, there's so much more we could have done. Let's start with highlights. What have you, what, give me a few things that you've done where you were like, that was amazing. I helped someone.
You know what? I really honestly have a hard time pinpointing because there's been so many of them. I will say that one of my favorite things to coach is our GDRX program because that's one thing I've learned. You give your body what it needs, you take away what's harming it, and the body it knows what to do, right? And I've seen that time and time again. So GDRX, we're eliminating a lot of the fake food. We're giving the body the nutrients, in these shakes and supplements. And just during that 5 weeks, so many things will, clear up for patients.
Right.
I really don't even know where to start because it's so often.
Right. I've seen that with GDRX. It's one of the highlights of being able to work with Dr. Saxena is that particular program. I came from the perspective of taking care of people with chronic Lyme disease, chronic mold toxicity. And it's not that I ignored the gut, but I didn't treat it as well as I do now, thanks to Dr. Saxena and that program. And there's a lot of times when just do that and you won't have to do much else. So the gut, it really is the foundation of our existence as multicellular animals, right? There's pretty simple animals in the world like sea cucumbers and starfish, and they don't have all the additional features that we have. They're just a gut, and they can be healthy as long as their gut works. We can't divide our body into all these different parts, our cardiovascular system and our uh, neuroendocrine system or whatever. It's our gut. We are just a big gut with a bunch of additional features. So I love that that's the thing that you've seen be so powerful. Maybe
And
are there times where you've tried to help a patient and you've thought they're just not getting it, or maybe some of those moments?
well, honestly, Matt, it was my biggest challenge. And sometimes you just have to learn that people are their own people and you can want everything for them, but they have to want it on their own. They have to want it themselves or, coaching though, motivational interviewing has really helped me to, even with my younger son now to be able to talk, because it's patient centered. It's not about what I want, it's about what they want.
Yeah. Well, that's a reality is we only get to make choices for ourselves. We can try to influence people and hopefully we influence them for good. Yeah. So Matt did well for a while, but then in his job, it was the cigarettes, it was the gluten, it was all the toxins that just
Hmm.
created more and more inflammation. And then the seizures became more frequent.
Yeah. Yeah. Yeah, it was a seizure, a grand mal seizure that eventually took his life. And in the autopsy report, it was inflammation in the brain. So exactly what you said, that was the reason. As far as a lot of people wonder, like, how can you be so strong, whenever you're a mom? Um, yeah, a part of them lives in you. You know what I mean? Like, but I have a very firm faith. So I really, truly believe I'm going to see him again and he's not going to have seizures and, he'll be able to really enjoy life. He wasn't even able to drive. I'm not saying he never did it because I know he did, but that was not, you know, I did a lot of worrying as a mom too.
Yeah, yeah. Well, I agree with you, and I think that well, we're in the majority when it comes to having a sense that there's something greater than just this, and that we will be with our loved ones again. So I am confident that you will see Matt again, and and yes, he won't have neuroinflammation anymore, and so his seizures will be gone. And it's it's a remarkable thing to see a parent that has the love for their children to both try to help them, but also know that they are independent agents and not there's no reason to blame yourself and there's no reason to be mad at Matt. And life is a fragile thing and a precious thing. And that's probably what makes it precious is that it is fragile, right? And if it were not so fleeting, then we would take it for granted like we do everything else. You're diving headlong into helping people. This was when you started to become a coach. Matt was still
Yeah.
living and doing well, right? And the tragedy of his death hasn't dissuaded you from saying, "Well, the truth is still the truth, and I'm still going to share with people," which is remarkable. Uh, Fantastic, really. Well, as a health coach, let's leave our listeners with a few things that they can do, things that you think would be valuable for them in their lives, whether it's as a mother, whether it's as a patient. What advice would you have for our listener?
Well, first of all, you know your kids, right? So if something's not right, get help, find out. And the other thing is, I would say, just because things are popular, like fast food and just even, what is it, 90 5%, maybe 90% of what's in a grocery store is not real food. It matters, so the habits that we start for them when they're young, they're going to carry on into adulthood. So sometimes I'll coach parents and they'll be like, well, they buy these things for their kids. And I'm like, oh my gosh, now's the time to like really help them so they don't end up like the majority of people out there, which, heart disease, diabetes, autoimmune, I can go on and on.
Yeah. Really, I mean, every disease that we experience, whether it's chronic or acute, is is going to be influenced by the foods that we eat, right? Like
Hmm.
we get sicker, and we'll get you're more likely to get you pneumonia and a UTI if you're eating poorly. It's not the cause of the pneumonia or the UTI, but your immune system is struggling, right? And for certain, all of our chronic diseases. So food is the foundation of everything. My daughter and well, she's 13. My wife and daughter are teaching a cooking class because summer has started, and my 13-year-old wanted a job, but she's too young, and so she said, "Well, Mom, can we teach a cooking class?" So she's got all these 8-year-olds downstairs right now, and today they're doing curry. Yesterday they did chicken and couscous with a tzatziki dressing. I can't remember what it was the second day, but it's been fun to talk to Lydia and Sarah and how these 8-year-olds, like one of the moms down the street texted and said, her daughter, she's like, my daughter won't eat anything but like chicken nuggets and macaroni. And she came home with this plate of food and she was tasting everything and she brought me pickled onions that you guys had made. And I'm like, yeah, you just have to expose them to it. Just give them the food and these kids want to eat it, right? Yesterday when they were doing the baked chicken, my wife said, yeah, a lot of the kids were really squeamish about, we rinsed off the chicken and we had to pat it dry and then we put olive oil on it and then we put a rub on it and the kids didn't want to touch it. And well, we have to come in contact with our food and say, this is what is keeping me alive. These are my nutrients. This is my experience. And so Lydia was really excited yesterday when she was talking about this little girl down the street who had been so picky. And now she's the one that's volunteering to try everything. And she wasn't squeamish at all when she got to pat the chicken dry and that sort of thing. And but I think there's a significant issue. We're not connected to our food, right? I don't know. I didn't grow up on a farm, but at some point people used to actually pull their food out of the dirt and, clean their own chickens and, whatever they hunted. So we need to get back to that.
I agree.
Yeah. All right. Well, Amber, your willingness to share this story is really remarkable. Your strength and your dedication to your health, but also the health of the people that you get to interact with as a health coach is a beautiful thing. Uh, Thank you. Thank you for letting me listen to your story and thank you for being willing to share it with our listeners. Your explanation of this neuroinflammation and that you couldn't quite put your finger on it, but then you could see it go away,
Hmm.
right? It's important. It's important for people to understand this. There's so many things that can be done. So thank you. Any parting thoughts before we wrap up?
I'm just grateful to be able to help other people. That's what gets me through. If I didn't do that, I think I would be a lot worse, because it's like I have a reason, to be able to move forward. So,
Yeah. Well, I mean, and it's love that connects us, right, as humans.
mhm.
And we don't necessarily say it that way, but you're connected to these people and you're helping people because you care and they feel that and you're sharing some of yourself with them, some love, and they're sharing some back. We don't do that any stronger than with our children or with our spouse, right? Which is why it's such when we lose those connections right now in the here and now, it's sad, but you're still connected to Matt because you know that the here and now is not all there is. And so you're able
Right.
to just move on with that, with love. And I, I, I wish we were better at this in, as a culture of just telling, people. I think that the best we do is we say thank you and you're welcome a lot, which are two sort of nice ways to say I love you without it being over the top.
Right.
But your patients probably experience that when they tell you, "Thank you for teaching me," and you say, "I'm happy to do it. Thank you for letting me," right?
Yeah.
That's why, because even though there's a there's a gap, I'll call it a gap, a time right now in your connection with your son that you don't get to talk to him the same way that you could have before, but you will again. Uh,
Yeah.
in the meantime, you get to, still stay connected by sharing your love with other people and feeling it back from them.
Yeah.
I was just
The
in
other
Tennessee, for
Mhm.
a gospel music fest, this past weekend, and I'm not evangelical the way I grew up, but, I loved this term that they seemed to use everywhere in the state, it felt like, that they would say instead of saying that someone had died, they would say, "He's crossed over," and
Mhm.
I thought that's the right way to talk about it. He's just not here now, so, anyway.
Yeah.
Well,
I
thank
I
you.
like the Bible says that that they're sleeping. It refers to death as sleeping, and to me that
Right.
that makes sense because when you're sleeping and you wake up, you have no idea how long you were asleep for,
Mhm.
and that's the way
And
with
and
him.
and yet you were still there, and you weren't
Yeah.
interacting with anyone because you were
Right.
sleeping, so you don't know how long it was you were asleep, and people know that you're asleep, and they're like, "Oh, he's just in the other room asleep. I don't wanna disturb him right now. I don't wanna wake him up." So,
Yeah. The
yeah,
other thing I was just
that's
going to mention to you, Dr. Peterson, is that the education that we get from Forum Health, I mean, Dr. Saxena, she's an educator. Like every week
yeah.
I meet with her at case conference and I love that. I love being able to continue to learn and then being able to be at case conference, at those conferences or not case conference, the yearly conference that we go
Oh,
to.
yeah, the yearly, summit. Yeah, 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 yeah.
Yeah, like just all of that is really good for me.
Yeah,
Yeah.
well, thank you, and, I love that at Forum, we're all doing it together. There's not like, "Oh, we're gonna have a conference for the MDs, and we're gonna have another conference for our PAs, and we're gonna have a different conference for our coaches." We it makes sense to just say, "Look, we're all caring about patients. Let's all get together and
Yeah.
participate."
And
So,
that's how we
thank you
learn.
for coming.
I remember the first year, I didn't understand a lot of what I was
Mhm.
hearing, when I went to the conference, but this
Right.
past year, I think I understood pretty much all of it, like the more you learn, the more
Yeah.
you grow. So it's really awesome. And our roundtables, we just continue to learn. So yeah, I appreciate that.
Well, you're always on the round table, and I always love seeing you there. So,
Oh,
I can tell that you love it. So thank you. Thank you.
yeah. Thank you.
Alright.
Thank you for joining us on the Forum Health Integrative Medicine podcast. Each episode, we help you understand your health from every angle and inspire your lifelong wellness journey. Follow the show, share it with someone who needs hope, leave a review, and take the next step toward feeling your best at forumhealth.com.